We're going to get started here. It's good to be here. I'm joined by Trinity Marrapodi from Canada Chiefs Conference, and we're looking forward to having this discussion. As far as just want to do a couple introductory notes. So welcome and thank you. This webinar series is something that we've gotten requests at SyncTimes recently to start first off for our existing clients. To start sharing a little more from what other clients of SyncTimes are doing, how they're using the tool to better their practice. And also we thought it'd be a good educational opportunity for others that maybe are interested in SyncTimes and want to learn more, to just learn what some of the best practices are that other health centers are utilizing and have implemented. We're grateful to be joined today by health center leaders from across the country, including a handful of existing SyncTimes clients. This conversation today will probably last about 20 minutes, and then we'll reserve the last 10 minutes for a Q&A session. If throughout the conversation you have any questions for Trinity or for me, feel free to submit them in the Q&A section. Ian and John from the SyncTimes team are monitoring that, and then we'll be able to cover those questions at the end. We'll also provide you at the end an email that'll include answers to any Q&A that came through, as well as contact information. And there will be a slide that's showing contact information both for myself and for Trinity. With that being said, I'm going to provide a couple of introductions. First off, my name's Alan. I'm the CEO at SyncTimes. It's my pleasure to work with health centers across the country and to help innovate and improve their workflows. So we'll share a little more about that. And I'm glad to be joined by Trinity Marrapodi. Trinity is the primary care nurse manager at Canada Chiefs Conference. She helps provide comprehensive outpatient services in the interior of Alaska. Trinity, what's the temperature there today?
Oh, it's actually pretty warm today. We're at 28 degrees, and it's almost like a heat wave.
Yeah, you've got it nice, huh?
Yeah.
The first time that I went to TCC, I remember it was -6 degrees, and everybody said, "Well, it was -40 last week, so it's nice out."
Yep.
Previously, Trinity had worked in hospitals, both in labor delivery and the emergency room. She's a lifelong Alaskan. She and her husband have 3 children there. Personally, I love visiting Trinity because she keeps a small dump truck sized stash of Dove chocolate and Reese's, the good stuff, in her office at TCC. She's in the middle of about 12 children, and unlike me, Trinity loves red-eye flights rather than just the normal flights. So I think that's because the children sleep better, right?
Yeah, that tends to help.
Yeah.
People are just nicer.
That has not been my experience. I don't feel nice on red-eye flights. So. So I'm just going to provide a brief introduction to SyncTimes just for context for everybody, and then introduce TCC, and then we'll be off to the races hearing Trinity's story. SyncTimes provides really 3 services for health centers. We provide a technology platform that helps people locate equipment and staff throughout the clinic, so know where people are. Second, communicate needs that patients have, what each patient needs next, and where they're at in their care. And then third, illuminate, which means we kind of shine a big bright light on health center operations and let people know what's going on, let administrators and care teams know what's going on, where the waits are, and what can be improved in order to improve their patient flow. Now I'm going to get to talk about TCC a little bit. These are a handful of pictures of the Chief Andrew Isaac Health Center in Fairbanks. It's a gorgeous facility. If you ever have the chance to be in Fairbanks, I imagine Trinity would be more than happy to give you a tour. It's pretty remarkable what they've done up there. TCC is an incredible operation. Their headquarters is in Fairbanks, Alaska, but their region covers 235,000 square miles, which is an area about 37% of the entire state, which is just a little smaller than the state of Texas. I think the old saying is everything's bigger in Alaska, right?
Yeah.
Within that area, they have 6 subregions and 42 member tribes. Trinity, what else would you add as far as introductions to TCC?
Yeah, so with all that, we probably service about 1,500 or 15,000 patients. And we're continuously growing. We offer primary care, eye, dental, radiology, and soon we're going to have our own surgery center. And with that, we have 3 family medicine teams and an urgent care team, and each consists of 5 to 7 providers and their support staff, including OB and peds. So we're very large for this clinic.
Yeah. Awesome. So I first met Trinity about 3 years ago, which feels like older than that. It was before the pandemic. And Trinity and the TCC team, they'd identified a number of challenges in their clinical workflows, which really led to our conversation. So Trinity, do you want to just, as far as kicking that off, do you want to just provide some context as to what some of those challenges were?
Sure. So if you could imagine having 5 to 7 providers per team, they each have about 2 rooms. So we have roughly between 15 to 20 rooms per each team. And when you needed something or help or some sort of emergency at that point, the only way for us to communicate was to open the door and scream for help, which is not ideal for a clinic. And if you look on the slide, you can see the little star in there. That's where my office was located. And so it's like perfectly centered to help people, but it doesn't help when you can't get the help you need quickly. So we've done a couple fun ways of trying to alleviate that problem prior to sync. We for our urgent care rooms, we installed doorbells in each room that had a series of the doorbells in the team room, and we had a number of them, so we knew which room was going off, and it wasn't very reliable. We also used a flag system to let you know that there was a provider in the room or you needed help or x-ray radiology or something in there, and it wasn't very consistent either. So those are just some of the little challenges and process workflows that we came up with to help with them.
Yeah, I remember, the first time I toured there, I remember thinking, okay, I'm going to Fairbanks, Alaska, seeing a tribal health center there. How big could the challenges be? And I mean, it's significant. First off, this is obviously a large facility. It's helping, patients from a large region. So you can imagine a patient whose journey is taking 24 hours to get to the health center, and then, they need to receive all of their care while they're there. TCC, I think, had done a pretty incredible job to date, but yeah, there were some of these challenges that still existed. I'm curious, just talking about Code Blue, specifically, you mentioned you kind of scream for help. What did that process look like? What would people do in those types of situations, Trinity?
Yeah, so prior to SyncTimes, you'd yell out the door to any support staff saying you needed help, that way you can go back and continue assisting the patient while they started bringing people, and so they would run and send somebody down to help you while they're calling an overhead page for the Code Blue. Our Code Blues are a little bit different right now, but we are changing it back to being the original. But normally it was rapid response is what most people would understand as our Code Blue. So we would have, you know, them pretty frequently throughout the week that we'd need assistance. So we have an overhead paging system, but you have to have a phone. And in all the clinic rooms, we don't have phones in every clinic room. So it made it difficult. We do have like a texting system that we can use through our computers, but you can't stop care trying to type and then hope that that person sees it. So immediate response consisted of us yelling.
Yeah, yeah, yelling is that's kind of what we see in most organizations. I think sometimes I like to stop at this point just to recognize and call out that TCC is a really good organization, and I think sometimes people hear this and think, oh, that's kind of wild. I think most health centers are facing challenges like that. And the fact that TCC had identified it and had done some work to improve it is a testament to your guys' commitment to quality. I'm curious, we haven't really talked about it yet, but security and safety was a big component of this system, staff safety and that type of thing. Would you mind just kind of talking a little bit about that, Trinity?
Yeah, so this is all over the nation, but I mean, with the psych facilities across the nation not having the capacity, especially after COVID started, but even prior to it, we just don't have enough services for that. So between psych and drug addiction or alcohol addiction patients, there are times that it was unsafe to be in a room with somebody. We had ways of marking certain people that we knew were problematic, and those are called BOLOs, which are be on the lookout. And so we would have security standing by for the ones that we knew, but the ones that hadn't had a response prior, there was no way of letting us know that this was a troublesome area. And so we would be in the room with a patient and then be in an unsafe situation. And so there was no way of getting help again without trying to get out of the door, which, I mean, that's what we encouraged our staff at the time. And that was one of the big pushes for this. We looked at a lot of different options to give us safety.
Yeah. Would you mind just, I'm just curious to hear that as you guys were looking at options, kind of how did you evaluate SyncTimes in the context of these challenges and whatever, the other solutions you're able to evaluate?
Yeah, so we looked at Voicera, which is a great company that would be able to communicate back and forth between the staff, but it didn't have something that would sync to overhead pages. So to get everybody there, it was a difficult one for that, but it would be nice to be able to talk back and forth to your staff. It didn't help or alleviate our room, like the communication between staff and provider. If a staff member was in the room and needed the provider to come in, there was no communication with that. And most of the time, you don't want to be interrupted by somebody talking and overhearing something. So it's nice to be able to communicate quietly without alerting a patient what's going on.
Yeah, I think, that's an example where, I've a few years ago, one of my children was in the ICU, and it was a great solution for that. There's interruptions, but that was kind of okay in that type of environment.
Mm-hmm.
In primary care, it's a little more annoying, when
Yeah.
you're spending 15, 20 minutes one-on-one with a patient and trying to, motivational interviewing and trying to engage them in their care. It can be kind of obnoxious if you're buzzing, in that
Yeah.
moment. Awesome. So tell me a little bit about when you saw SyncTimes for the first time, what were your thoughts on it? I know it's a pretty new technology. It's not something a lot of people, just think, hey, this is AX, right? This isn't something you probably had witnessed before.
I can't even explain it. It was exciting for us to have this way of communicating, and honestly, it was even more exciting when you guys had upgraded it to the light with the lights and stuff. Coming in that next morning, it was just like, whoa, this made me feel like Christmas. I'm not gonna lie. But it was a very nice.
Usually we get Star Wars, so.
Yeah, well, that too. But at that time, I think there were so many different colored lights. The green and the red and stuff. It reminded me of Christmas. But it was exciting. And getting to actually like test it out really, it just took a weight off of me because of the complications that we've had in the past, to know that we had an option to help people, and the communication being better between everybody.
Yeah. Let me just give some context. So when Trinity is talking about the lights and the tablets, so the system that we provide includes tablets just outside and inside exam rooms, and those are used for communication. So some of the things that we talked about, and we'll talk a little more with Trinity here, is if someone's in an exam room and they need their MA or they need a provider or there's a code blue, there's icons on these tablets that can be clicked, and that triggers a workflow, that triggers an action. So as an example, if someone's in a room and they need their MA, they can click a button for that. If a patient goes down and a rapid response or a code blue needs to be triggered, they can select that, and it alerts the rest of the team, both through those tablets and then also on their desktop, on their phone, or on large, what we call flow station displays, where the teams can see what's going on throughout the entire clinic. And that's what you're seeing here on the right. So that's just some context. When Trinity mentioned I like the Christmas analogy. The sides of those tablets outside the room have lights, so you can just look down the hall and see roughly the status of the room. So green would mean that support staff is in the room with the patient. Red would mean the patient's alone. Blue means the patient's with a provider. There's a couple other colors. So green and red are the best ones because then it's all Christmas. Huh?
It is, yeah.
And, especially with Fairbanks. Fairbanks is what, 10 miles from the North Pole.
Where I currently live, yeah.
Yeah, when I visited, I found it was kind of a tourist trap, but it's a cute tourist trap. So yeah, worth a visit. Great. So I think, I'd just be curious to ask Trinity, what impact has this had on workflows? What impact on your team and on your patient care?
Oh man, I mean, I could probably talk for the next hour on the impact. And that's something to say because, when you're passionate about something, again, I didn't say this to everybody, but I'm not paid or anything to do this. When I was able to see that weight come off, it's something that you get passionate about. And so I can talk about things like that all the time. The impact. Well, codes had went from a 15-minute response time to probably 2 to 3 minutes. What happens when you need help immediately? You push that button, it audiates a voice overhead. It puts a banner on every screen and says what room you're going to. And it overhead pages that. And so all the help you need gets it all at the same time. And to me, that is just by far so wonderful. So we all can come in and grab our stuff on the way and see that patient. But even more so you heard code blue and you're like, oh man, I missed what room it is. Every SyncTimes panel will show the room on it as you're going to it. So you can't get lost. Not to mention, it also has lights that are blinking. So you have an audio or a visual to follow it. So that helped. The staff being able to communicate with each other, that one we do use a lot because you can put up the things that you're going to be doing in throughout the course of the visit. So say that you want them to get an injection, go to x-ray, and then discharge, you can put those up so you know what the next steps are. If the provider has to go into the next room and hasn't had a chance to debrief, it's on the SyncTime so they know what their next plan is. They can look in the chart, follow the orders, and look at SyncTimes to know what order of things that they want to do. The other thing that we utilize it for, again, we have such a large building, is equipment goes missing. So we have multiple EKG machines, we have multiple ultrasounds, we have oxygen tanks and vital sign carts. And that's what we track most out of everything. I know a lot of people worry about tracking people, but honestly, it's the tracking of our supplies that help a lot. We do occasionally look for somebody if we're supposed to meet them and then they weren't where they were supposed to be, but it's not no one has ever, since we went live with it, felt like their personal space has been invaded by it.
Yeah.
And then, oh man, what else?
Can I ask a question here for you, Trinity?
Absolutely.
I'm just so you guys, and we have a handful of health centers on that are signed. We have an implementation date, but they haven't actually gone live yet. At TCC, you guys did a good job communicating with the teams and just getting them excited about this before we even went live. Would you mind just sharing a little bit about what went into that and how you guys, really communicated this so effectively to your teams?
Yeah, so we do have a monthly meeting that we talk with everybody about, and we talked about the different badges and then what SyncTimes. It's not really talking about, you don't focus on the negative, right? So people feeling like they're going to be tracked. You focus on the positive, where, hey, you know how long you spent searching for that EKG? You can search it up in SyncTimes and be able to find that. And so we got really excited to promote it and then utilize it on, we were promoting time that we could spend with patients and alone time. So that was a really big thing because we used to have a lot of patient complaints probably, I wouldn't say 90%, but an 80% patient complaint rate because of being left alone for long periods of time because of the communication. As I said, they might have went into a different room and hadn't got to communicate what's needed next and these kind of things. And that decreased to probably a 10%. And most of the time when we come back to find out why these people were marked and upset, there's a way SyncTimes did it where they could say, how was your visit today? And people would put upset. Most of the time it was because they weren't feeling well, not because their care. And they're like, oh no, the care was great, I just don't feel well. And so they just didn't read it correctly. And so that really helped that system. And we've also used it for contact tracing. If somebody was in a room and we needed to call them back, we were able to figure out what room they were in.
Yeah. I think want to open it up here. So we've got some questions here that we can start with. But if anybody else that's attending has questions, feel free to add them here. Something we haven't talked about yet, and this came through just as a question here, is how has your organization used the reporting functionality from SyncTimes? What do you guys kind of practically, how do you use that?
Well, actually, we used it in many different ways. So our patient experience uses it for the time that they are, how, like our percent of people being happy with their visit and being upset. They also use it to help us improve our time alone. So we do a monthly recap on it and see where people are doing it. So average alone time prior to SyncTimes was 30 to 35 minutes, and now it's about 18. It's still above our goal of 15, but we are actually reworking that system now on things that we can do to improve that, offering, incentivized things of how we can improve those situations. But ultimately, the patients are far more happy. And then we've also used it again for the tracking of, we're using it to figure out our room utilization. All the providers are saying, I need more rooms, I don't have enough rooms to see the patients. And we were able to look at how often rooms are being used. And we're finding out that there are certain rooms that aren't being used at all because that provider's gone or something like that. And so we need to, that's actually implemented this new standardization for our clinic where we're making all the rooms the same. So you could use any room, and then we can, that way we're getting to use more rooms at a time.
Yeah. I think that's something that, our belief and what you guys have been able to implement is a lot of times in staff meetings when you have, you kind of have administrative leadership and then you have your care teams. And Trinity, you kind of sit in the middle of those two, right? Where you are a nurse and you do, work with patients, but you also have an administrative role. A lot of times we get a bit of a just disconnect there, right? Where providers are saying, hey, I need 3 more exam rooms. And administrative staff are saying, I don't know. I mean, I walk around and I feel like there's rooms that are available. And so being able to just quantify that, take the emotion out of those conversations and just say, well, here's the fact, the room is utilized 37% of the time, is really good. And it takes some good leadership. I think that's what you guys have done really well, is saying, okay, we're going to be a data-driven organization. We're not going to just, drive based on kind of the seat of our pants, what we feel is right or is not right.
Yeah.
I think here's the next question coming through here. Would you mind just sharing how your workflows have evolved over time? So what did you do to first transition your workflows? Meaning you had things you guys were already doing. It must have been a bit of a process to get the teams up and running, doing something different. And then have those stayed the same or have they changed, and in what ways?
Yeah, so to improve our workflows, the first thing we did was we didn't want to try and install everything at once. So we didn't use very many icons to start with. We just used what are your first, I think 9 common things that you need to do. And we implemented that. I mean, the first goal was just getting people to use it. So let's just start getting patients in the room, turning the device on, which is just a click of the button saying the patient's in the room. It's very simple. You don't have any login and stuff. You just walk in. So you mark that you're there. And so that was our first goal, is like, hey, let's just utilize the machine here. And then afterwards, then people were like, oh, well, could we do this? Because this would really help. So they started using, okay, well, I want an injection, and then the patient's good to go, or an x-ray. And so we slowly started throwing in one step at a time. And now I think we're probably up to at least 20 different icons, and still constantly asking for more, because we can see how much utilization. I was just talking to one of my case managers, where we're separated into probably 5 different buildings too, because we can't fit everybody into our building that's working. And she's like, yeah, I love SyncTimes because I can just walk up the hall and be like, oh, this room's available, and jump in there and use it. Where before you wouldn't be able to know what rooms are actually being in use. You'd have to go talk to somebody and ask if you could try to use that room or something. So
Yeah, no, that's awesome. That team that you talked about has been really impressive at TCC specifically. And I'm trying to remember, what do we call it there? It's a different name than we use for managing workflows and icons. Is that our icon governance? Is that right?
oh yeah, that's what we call icon governance.
Yeah, the icon governance committee, which sounds just hilarious. So
Yeah.
I very much enjoy that name. But they meet on, it's a quarterly basis. We have a representative, 1 or 2 from SyncTimes that joined for that. And then we're discussing those requests that have come in. Kim Showalter is one of the medical assistant team leads. And so she kind of manages that team and says, all right, we've had these 15 requests. Let's just prioritize them. Let's figure out what we're going to do this quarter, so we aren't adding 10 icons at once. And you guys have done a great job just slowly implementing workflows. And I think every one of them gets used. They aren't things that just sit there idly.
Nope. And I mean, with that, we also meet prior to that meeting, and we've already whittled it down. So we're not bombarding you with, these ones are the ones that actually we feel is important. And we figured out how to use some icons for some of the things that we wanted, that we didn't think about at the time, because the icons have some different functions that we can do as well.
Mm-hmm. Yeah, that's awesome. I think just had a question. You had mentioned the patient experience team and just talking about their work. Would you mind just sharing a little bit about how they use the data and how you guys actually physically did that, got the patient experience from, where it was to where it is now, and like what tactically did you actually do to make that happen? It doesn't just happen on its own.
No, well, it all started with just one patient experience person, and they would monitor any complaints that came in, and most of them were over the telephone or written in an email later on. And so since SyncTimes got involved, it actually, those upset faces or happy faces or 15-minute alarms will ding to them. And now they're a team of probably 9, because we've just exploded with, we want to offer the best care we can. So when they get any of those, like they'll go check on a patient if it's been longer than 15 minutes that somebody hasn't went and checked on them. They'll go check on them and just see what's going on, offer them something if they need it, or talk with the provider staff to see, what's going on. Because, sometimes there is good reason we're waiting on a test result to come back. So at least we're able to have someone go check on them. And then they immediately will respond to any time that somebody has an upset face. And that's within like 2 minutes of them touching it. And so a lot of patients were crazily surprised when they saw somebody come in and like, wow, I mean, obviously they knocked, but they're like, I didn't realize that we'd have such a quick response. And most of the time, again, they would be like, oh no, I was just not feeling well. And it wasn't that their service was poor. So.
Yeah. I think that just commitment to saying, hey, if a patient is feeling upset while they're in the clinic, we want to make sure that they leave the clinic feeling, content with their visit, rather than going to Google or Facebook and, attacking, right?
Yeah, and we do patient recovery where we offer some coffee cards or things like that to try and improve their visit because sometimes things are out of our control and we try and improve it.
Yeah. Awesome. Well, I think we're coming up on time. We had committed everybody to do a half hour, so want to just wrap up here. This is Trinity's contact information and my contact information, so feel free to reach out via email if you have any questions for either of us. Trinity said she's happy for us to share her email. Don't sign her up for anything obnoxious. No ads or anything like that. I think I had one last question for you, Trinity, if that's all right, and
Yeah.
then we can jump off. So, kind of last question is, as you look at the system now, where do you kind of see this going for your organization, and then also where would you like to see SyncTimes in 3 to 5 years? What would be the kind of the assets for your organization?
Well, as I said, we're about to have a surgery center, and we have a dental and eye clinic. And I know that we were talking about when you guys come up here. I know we're already putting it into our new urgent care that's moving into the new building, but in our dental clinic, you guys had actually implemented it into other dental clinics, and so I am excited to see. Our dental team being able to use it because right now they still do they don't have a way of communicating without hollering for help, codes and stuff. And so I really do think that that will improve some things because we do have some patients that don't do well when they got sedated for their surgeries up in dental. So it will be a nice thing to have. So I do want to see it there. And then, as you said, we have a couple sub-regional clinics. It's only out in one of them, I believe, out in
Yeah, Toke.
Toke, but I would like to see it out in Galena, one of the other villages that I've really been out with. Our other villages are somewhat more small, but the sub-regionals are like mini Chief Andrew Isaacs where they can do a lot more. They do x-rays and labs and stuff out there.
Yeah.
And I think that that will improve a lot of processes. Um, and whether or not we can get it out in the other little villages would be fine too, because some of them are larger too. But
Yeah. Well, thank you, Trinity. I think we're grateful for the partnership. I can't say enough though. SyncTimes is a much better product, a much better system. We're a much better company because of TCC and because of other organizations like TCC. You guys have, as Trinity, you probably remember from early on. In a lot of ways, you guys said, "Hey, this is close, but." And we've had to take a look at things and say, okay, let's get rid of that but.
well, and yeah, and Alan, the one thing that I have to say about SyncTimes is I've worked on implementing multiple new products throughout all my years of nursing, and are made promises by multiple places. Oh yeah, well we will, we're always available to you. We'll help you do this. Our product is ever evolving, and we can customize it to you. Um, I have to say the only place that I've actually seen that promise is from SyncTimes. You guys have always been responsive and jumping in to help. I mean, I've sent an email and at a very odd time for you, Alan, and had a response back in like 2 hours, and I'm like, you should be sleeping. So to just have a place that still meets with us on a quarterly basis is to me phenomenal. And I just appreciate the support that you guys have offered us because that's the only way that this product would continue to work.
Yeah. Well, we're excited. We're grateful for the team. If everybody can give a virtual round of applause for Trinity. You never would have known it, but she says she doesn't love presenting. I don't buy it. You're a natural, Trinity. So thank you, and we're grateful for everybody for joining.